Well, good afternoon. It's really great to be in Indian River County. Really love everything everyone's doing here. I want to thank uh, Indian River County, of course. We have a couple commissioners, O'Brien and Ehrman. Where are you guys at? Yeah, thank you. Appreciate it. And of course, Senator Mayfield, who's doing such a good job. I want to thank you guys. We are here to highlight this great vaccination site. Led by the county, supplied by the state at Vero Beach's Fairgrounds and Expo Center. And you see it, how they do it. They got a great efficient setup, make it easy for the seniors to be able to get in here. They will do 500 vaccinations today, and they're following my executive order and focusing those vaccinations on members of the community who are age 65 and older. And you can also go online, alertindianriver.com, and people have been using that. And they're actually going to expand some of the telephone options as well, because we take it for granted, some of the people who may be in younger generations, but not everyone is necessarily plugged in on all the internet. So we appreciate Indian River doing that, and thank you all for what you're doing to make it happen. And basically what we've told them is, if you're processing this, if you're getting shots in people's arms, we want to make sure that you have the vaccines that you need. And so as people are doing it, as they're using it, if there's other folks that aren't, we're going to make sure that we shift it over to places like Indian River where they're doing well. We are expected to get about 250,000 additional doses coming next week. It'll be split roughly half between Pfizer and Moderna. But if you look at how these efforts have ramped up just over the past few days, you're seeing major health systems throughout Florida, do several thousand shots a day at this point. And many of the hospitals have already completed giving vaccines to their healthcare workers. So they're starting to actively engage in the community with 65 and plus. And then, of course, the state, we're supplying sites like this. We're also supporting converting some of the big test sites that we've had for so long into vaccine distribution sites where people can go up and, similar to this, a little bit bigger footprint, similar to this, get the shot, and then be observed. And so we're in Hard Rock Stadium yesterday down in Miami, and we've got some more of those that'll be coming very soon throughout the state. The good thing about what they're doing here and some of these other sites, they're making it very efficient for seniors to come through here. They don't even need to leave their car. They go in. They have to do forms. They give kind of the rundown of the EUA. They obviously have to sign, and then at that point they get a time to come back right when they get their booster shot. But they go through and they're able to get the shot sitting right in the car, and then you see they will park, and then they'll just be monitored for 15 minutes. There's been very, very few reactions nationwide to this, but they do it to make sure that, so after 15 minutes, if that's good, then people are going on their way. So soup to nuts, this is, a relatively convenient evolution. And so one, that's just good for efficiency and administration, but it's also good for the folks who are getting the shots to be able to come here and do it. And that's the key, getting into communities, particularly where we have high senior population, and making the vaccine available. That's going to continue to be a top priority. So they're doing a good job here. We're also working with Publix. And so today there was registration for 3 counties, unfortunately not Indian River yet, but we may get here. You have Citrus, Hernando, and Ocala, so more central Florida, where you can go and register to go into a Publix pharmacy. And they're going to do at least 100 shots a day at 22 pharmacy locations throughout those 3 counties. And so states provided them with a good amount of the vaccine to be able to accomplish that mission. And that's something, if people enjoy that and that's effective, man, just think how many Publix are throughout the state of Florida. And even if they're doing, there's 750 plus pharmacies, even if they're doing 50 shots a day at each one of those, that's huge numbers in terms of what we're able to do. And one thing we noticed is having shots in hospitals is good, but there's some folks that just don't like going into the hospital. Now, I think they do a good job at mitigating corona, and I don't think it's fair to think that, but I think there is a little bit of hesitancy sometimes. But everyone's going to the grocery store. I mean, people are going, they're doing that once or twice a week even, and they've been doing that for many, many months. And so to be able to have that there, I think is really, really good. And so we'll be looking at that and monitoring how that goes, but just continuing to also fight for more vaccines because, my view would be you have infrastructure, you have counties that we're supplying, you have some of these big health systems that are really starting to rack up some good numbers in terms of shots in arms. I was just down in Miami on Monday. You have one of their big health systems, Jackson. They're doing several thousand a day. They just booked 12,000 appointments over the next however many days. And so they're asking for more. And so we're making sure they get more. So that's really good. There's more infrastructure now that can be supplied. But if we can get additional supply, we're really going to be able to move that in places where it'll effectively go off the shelf pretty quickly. And that's going to be really good for our senior citizens. Right now, the plurality of shots in terms of you break it down by age group, the highest plurality by far is age 65 to 74. And we're happy with that. We want it to continue to skew older because we believe that's where the protection is going to matter the most. Many states throughout the country right now do not even permit 65 to 74-year-olds. In fact, some aren't even doing seniors outside of nursing homes and long-term care facilities. And so, we were the first to be in the long-term care and nursing homes, first state. We were also the first state to start vaccinating in our general population with 65 and plus. And look, we have 4.4 million seniors. Now, not all want it, but many do. We clearly don't have that many vaccine. So there is high demand for it. And just people should know we're going to work till we get it to everyone who wants it. But I think you're going to see those numbers. This week, there'll be more shots done than the week before. The week before was more than the week before that. And next week, as long as we get supply, will be more than this week. And so we really look forward to those numbers growing, and we're going to remain vigilant in being able to get that to the people that who needs it. So I just want to thank counties like Indian River. I was just over in Manatee County. They came to us very early, and as soon as the vaccine started getting the hospitals, and they said, look, here we've planned for this. Here's what we want to do. Can you supply it? We've provided support for that, and they have a very efficient operation, very similar to this. So that's really important. And I also want to thank a lot of our hospital systems for really working hard. They're reaching out to the seniors in their areas and getting them vaccinated. And of course, we're going to continue to do innovative things, whether it's Publix, whether it's the drive-through sites, until we get it to everyone who wants it, obviously, adult who wants it, but prioritizing our senior citizens is really the way to go. So we're into 2021. 2020 was a tough year. I think this vaccine should provide a lot of people a lot of hope and optimism, and it's our number one priority. So we're going to keep working day and night to be able to deliver it. Thanks. Anyone got any questions? So I think someone must not know what they're talking about. First of all, the nursing homes is done in conjunction with CVS and Walgreens. They have a contract with the federal government. Now, when they weren't ready to do the first week, we sent strike teams in. We did over 100 nursing homes in two heavily senior-dominated counties, Pinellas and Broward, in 6 days. CVS and Walgreens has been proceeding with their mission. They've gotten a lot of allotment of vaccine because we know the nursing home residents and long-term care residents are the most vulnerable. And now we're putting additional manpower into completing the rest of the long-term care that CVS and Walgreens hasn't gotten to yet. So I think it's something that's very important. I think those nursing home residents have had it awful for months and months of quasi-isolation, and we want to return them to normal. So I think it's absolutely the right thing to do to focus on our most vulnerable seniors. And so we're going to continue with that mission until that's done. Look, I wish that some of them, may have gone a little faster on those end, but it is what it is. We're filling gaps again, and we're going to do it. And I also think it's the right thing to do to focus on our seniors generally. I mean, a lot of these other states are not putting seniors first And I think you're going to see, the results are going to be much, much better by doing that. And so we're happy to have so many seniors already, and you're going to see that number continue to grow. And we're working every day to find innovative ways to be able to do it. But we're doing it in ways that are harnessing our existing healthcare infrastructure, which is very, very important. The last thing you would want to do is have the government handle vaccinating everybody. You want to get into the hands of the folks who are doing it. So, public steps up. They have easy access. We'll do it. You have counties. They have sites. You'll do it. Obviously, the state's involved too. Hospitals really starting to pick up a lot. And so we're excited to be able to see that. So, right. So what we're going to be doing is we want to get vaccine to folks, particularly in settings that they trust. And so we view some of the places, some of the African-American churches, some of the synagogues as a great place to do. So in Escambia, they had 500 seniors at one of the churches. So we're going to be doing more of that throughout the state of Florida. There's not, the demand for it is not the same across different racial groups. And so we just want, if we have somebody who's a pastor who can say, hey, this is important, it's good for your health, you should do it, it's going to be a lot more buy-in when you do that. And so it's something we look forward to continuing to do. It could be. I mean, basically what we're doing is we're reaching out to folks. Some folks are reaching out. And if they ask, basically what we want to do is say, okay, we'll set up a pod somewhere. Can we do 500 people? Can we get that done? And if we can get a certain amount, you're going to go and you're going to knock it out. So we're going to have more of that going on this weekend, which I think will be really, really exciting. So I guess the question is do you have to stay within your county? Look, I think that if it's a county site, I think obviously they want to serve their citizens of their county. I mean, I totally understand that. When you talk about some of these big health systems, for example, we have parts of Florida. I mean, I was just in Santa Rosa County. That's basically right. I mean, it's Pensacola, but it's a different county than Pensacola. I mean, Escambia is right next door. So you're going to have folks there that are going to be going to Sacred Heart Hospital to seek a vaccine. In fact, we actually just did a site in Santa Rosa, so they're able to go there right now. So I think it's just kind of use common sense. But I obviously, the local governments, if they're involved in it, they're going to probably be reaching out to folks who are in their counties. I know hospitals, for example, down in South Florida, they have folks in all three of those counties. They don't necessarily say you only have to be in one, but they also have patients in multiple counties too. So it's not necessarily that big of a leap for them. So this is something we're already investigating. As soon as we found out about it, the allegation is you had a nursing home that was being serviced by either CVS or Walgreens. And when you go in to do that, you have to prep it. And so they have to get consent forms because, there's some of those residents that can't consent. And the allegation is that maybe those consent forms were given to people who were not nursing home residents. So obviously that's something that is being investigated, needs to be. The nursing home and long-term care program is for residents and staff of long-term care facilities. That's who it's for. Look, if you're not a resident or a staff member of a long-term care facility, but you're 65 and up, there's other options for you. We want you to get vaccinated, but to go under that rubric when you're not a resident and you're not a staff member, that's definitely going outside of what the guidance is and what the program's for. So when we found out about it, we got the Inspector General looking at it. The Department of Health has already investigated, and we think we'll have something pretty soon on that. So not put these seniors first, put these elderly nursing home residents first. And then the staff, too, is important because they're interacting with those folks on a daily basis. But anything going to CVS, Walgreens through that program, or if it's a state strike team, which this wasn't, our strike teams were Broward and Pinellas at that time, it's got to be for the residents and the staff. So we'll have more news. Yes, sir.
Vice Chairman
Yeah.
Governor, first on behalf of the entire board, I want to thank you for taking time to come here and see our operation. We're very proud of what our health department is doing, our EMS folks, our other community partners, and as you mentioned, it's a very efficient operation, and so we're very pleased with it. Glad you take time to come see it. If you need a formal ask, I'll be willing to say right now, if you get us more vaccines, we'll get them in people's arms. No doubt about it.
How many do you think you could do on a day on the max?
Right now, well, just so you know, today we're doing 500.
Right.
Yesterday we did 500. When we put that out, we filled those 1,000 spots in 7 minutes.
I know, yeah.
So we'll be able to get out as many as you give us. We can do this 7 days a week.
Yeah. So what I would say is, well, one, I've already told my folks we want to help. We want to be there for you guys. Yeah, I would recommend doing it 7. You know, we're doing any state site we're running, we're doing 7. And then if you look, I know it's not always easy, but if you can do an additional lane and you have a model that works, that's going to be the top thing for us to be moving vaccine to, because we know you're going to use it and we know it's going to get in the arms of the people who need it the most. So, you know, we're here for you. As I said, I'm trying to get even more vaccine for this coming week, because I think we have so much infrastructure that's popping that I think just getting it out there, and I think you'll see it really take off over and above, you know, what we're already doing. But clearly this week is going to be much more shots than last week was. And I imagine the following week, as long as we have the vaccine, is going to be there as well. So stay tuned, guys. We will be coming back very soon. God bless everybody.